Have you ever wondered if your anxiety might be linked to something other than everyday stress? What if it's actually your thyroid causing all this nervousness and restlessness? Did you know that thyroid problems can trigger anxiety symptoms that often go unnoticed? In this video, we'll explore the relationship between anxiety and the thyroid. What might be going on behind your symptoms, and how to find out if the cause of your anxiety is actually hormonal. Is your body trying to send you a signal? As we already know, the thyroid is a small gland located at the base of the neck, but its impact on the body is immense. It is responsible for producing hormones that control metabolism, influencing how the body uses energy. These thyroid hormones, mainly T3, triiodothyronine, and T4, thyroxine, affect almost every organ in the body, regulating the rhythm of the heartbeat, the functioning of the digestive system, body temperature control, and even mood and mental well-being. When the thyroid functions in an unbalanced way, either producing too many or too few hormones, the effects on the body and mind can be profound. For this reason, the hormonal balance provided by the thyroid is fundamental to keeping not only the body functioning properly, but also to guaranteeing emotional stability. A dysfunction in this gland can drastically alter the mental state, leading to the appearance of symptoms that are often mistaken for independent psychological conditions, such as anxiety. Understanding this connection is crucial for anyone looking to better understand the causes behind their symptoms and get the right treatment. The two main problems affecting the thyroid are hyperthyroidism and hypothyroidism, and both can have significant impacts on mental health, especially in relation to anxiety. In hyperthyroidism, the thyroid overproduces hormones, speeding up the metabolism. This increase in metabolic activity can trigger physical and mental symptoms that are often mistaken for anxiety. Heart palpitations, tremors, excessive sweating, and a constant feeling of agitation are common. Many people with hyperthyroidism report feeling restless, irritable, and finding it difficult to relax, symptoms often associated with anxiety. This state of hormonal hyperactivity creates a feeling of always being on edge, which can further increase nervousness and stress. Hypothyroidism, on the other hand, occurs when the thyroid doesn't produce enough hormones, slowing down the metabolism. Although the best-known symptoms of hypothyroidism include fatigue, weight gain, and depression, it can also contribute to symptoms of anxiety. The extreme tiredness and lack of energy caused by hypothyroidism can generate a feeling of helplessness, creating a cycle of worry and anxiety. In some cases, people may find it difficult to differentiate whether what they are feeling is anxiety or the effects of the lack of energy and motivation that accompany hypothyroidism. Understanding the difference between hyperthyroidism and hypothyroidism is crucial to determining the appropriate treatment, especially when anxiety symptoms are involved. A full medical assessment, including hormone tests, can help identify the cause and allow treatment to be targeted correctly, relieving both physical and mental symptoms. Before continuing, if you're learning about the thyroid and want to delve even deeper into your health, check out the video description for my exclusive ebook with valuable information and practical tips to better understand your thyroid health. Also, subscribe to the channel, turn on notifications, and join our community to find out more. To diagnose anxiety caused by thyroid problems, the first step is to see a doctor, preferably a general practitioner or endocrinologist, for a full assessment. The doctor will begin the process with a detailed anamnesis, in which you should describe all the symptoms you're feeling, both physical and emotional. Symptoms such as palpitations, tremors, unexplained weight loss or gain, excessive tiredness, and sudden mood swings, combined with anxiety, can indicate a thyroid imbalance. As well as discussing your symptoms, the doctor will also take your family history into account. If there are cases of thyroid disease in the family, such as hyperthyroidism or hypothyroidism, this increases the likelihood of a link between your anxiety and thyroid function. The doctor will also assess your personal history, including the presence of other health conditions and factors such as age and lifestyle. Based on the clinical assessment, the doctor will order laboratory tests, mainly a blood test to measure the levels of thyroid hormones, T3, T4, and TSH, thyroid-stimulating hormone. These tests help to identify whether there is excessive or insufficient production of hormones, which may be causing the symptoms of anxiety. If hormone levels are altered, this confirms thyroid dysfunction as the cause of anxiety. Depending on the results, the doctor may order additional tests, such as a thyroid ultrasound, to check for nodules or other physical changes in the gland. With a confirmed diagnosis, treatment can be started to regulate thyroid function, which usually relieves anxiety symptoms over time. Treatment for thyroid-related anxiety begins with correcting the underlying hormonal imbalance. Since anxiety can be a symptom of thyroid problems such as hyperthyroidism or hypothyroidism, it is essential to treat the root cause in order to relieve symptoms effectively. For hyperthyroidism, the aim is to reduce the excessive production of thyroid hormones. This can be done using antithyroid drugs, which decrease the production of T3 and T4 hormones. In some cases, treatment with radioactive iodine is recommended to decrease the activity of the thyroid gland. As hormone levels return to normal, many of the symptoms of anxiety, such as palpitations and restlessness, also tend to decrease. In the case of hypothyroidism, treatment involves hormone replacement. Doctors usually prescribe levothyroxine, a synthetic hormone that replaces T4, restoring normal hormone levels in the body. Over time, this helps to reduce tiredness, improve mood, and balance energy levels, which can result in a decrease in anxiety symptoms related to low thyroid activity. In addition to specific thyroid treatments, health professionals can recommend complementary approaches to help control anxiety. Cognitive behavioral therapy, CBT, is an effective form of psychological treatment, which helps to identify and modify thought patterns that may be fueling anxiety. Relaxation techniques such as meditation, yoga, and deep breathing exercises can also be beneficial in reducing anxiety symptoms. In some cases, if anxiety is intense or persists even after hormone treatment, anxiolytic medication can be prescribed temporarily to help manage symptoms. However, the main focus should be on correcting the hormonal imbalance, as this is the underlying cause of anxiety in many cases. Effective thyroid treatment, along with therapeutic interventions and, when necessary, medication, can help restore both physical and mental balance, relieving anxiety in a lasting way. Knowing when to see a doctor is crucial if you are experiencing anxiety symptoms that may be related to your thyroid. Many people delay seeking help, believing that their symptoms are purely psychological, such as generalized anxiety, without realizing that a hormonal dysfunction may be the real cause. It's important to look out for persistent physical symptoms such as palpitations, tremors, unexplained weight loss or gain, excessive sweating, and extreme fatigue. If you are experiencing sudden mood swings, such as intense anxiety, irritability, or even depression, these signs could also indicate a thyroid problem, especially if accompanied by other physical symptoms. In addition, a family history of thyroid problems, such as hyperthyroidism or hypothyroidism, should be an indication to seek medical evaluation. If you've already had blood tests that revealed high or low levels of TSH, T3, and T4, it's essential to monitor these results with a health professional. Finally, if you've been struggling to manage your anxiety, even after trying psychological treatment or medication, it's possible that the source of the problem is your thyroid. An endocrinologist can order specific tests to check hormone levels and determine whether the gland is working properly. Appropriate treatment, which may include hormone replacement or adjustments to medication, can bring significant relief to both physical and mental symptoms, including anxiety. Seeking medical help is therefore an important step in ensuring that you receive the correct diagnosis and treatment. What about you? Have you ever had a lot of anxiety? What were the worst symptoms you experienced? Tell us your story in the comments and let's share experiences. If you think this content has helped you in any way, subscribe to the channel, like the video, and share it with a friend who needs to know. Thanks for watching!